I put a scoop of glutamine in my morning shot for months. Then I started noticing less bloating after travel and faster recovery on heavy training days. If that sounds like hype, hold on. In this video, we'll cut through what glutamine really does, who might benefit, and how to choose and use it safely. First, what is glutamine? It's an amino acid, one of the building blocks of protein. Most of the time, your body makes enough of it, which is why we call it non-essential. But under stress, illness, surgery, prolonged heavy training, or when diet is poor, your demand can outstrip supply. That's why many experts call it conditionally essential. You get glutamine from your own synthesis and from food. Meat, dairy, eggs are rich sources, and plant foods like beans, cabbage, spinach, and beets contain smaller amounts. You'll most often see supplements labeled L-glutamine, which is the same form your body uses. If you want more practical supplement breakdowns like this, hit subscribe and tap the bell. There's a lot more nuance coming up. One of the clearest places glutamine plays a role is the gut. Enterocytes, the cells that line the small intestine, use glutamine as a primary fuel. Think of enterocytes as frontline workers who need steady food to keep the intestinal wall intact. When those cells are well fed, the mucosal layer holds together better, and intestinal permeability tends to be lower. That matters because a leaky gut isn't a disease label by itself, but can contribute to symptoms like bloating, sensitivity, and influence systemic immune activation. Research suggests that supplemental glutamine can support mucosal repair in certain contexts, after intestinal injury, for short-term support during chemotherapy-related mucositis, or in some clinical nutrition settings. For conditions like IBS or inflammatory bowel disease, some studies indicate potential benefit for symptoms or barrier function, but the evidence is mixed and not conclusive. In plain terms, glutamine may be a useful supportive tool for gut integrity in specific situations, but it's not a universal fix and shouldn't replace medical treatment. That gut connection also ties into the gut-brain axis. A large portion of our body's serotonin synthesis happens in the gut, and intestinal health influences signaling between the gut and brain. By supporting enterocyte health and the mucosal environment, glutamine can indirectly influence those pathways. This doesn't mean glutamine is a direct mood treatment, but it's part of the biological network that links digestion, immunity, and central nervous system signaling. On the immune front, glutamine is fuel for immune cells. Lymphocytes and macrophages use it actively during proliferation and immune responses. During times of acute stress or infection, immune cells' glutamine demand rises. Studies indicate that maintaining adequate glutamine availability can help immune function recover faster after intense stress, and that is one reason it's used in some clinical nutrition formulas. Beyond fueling immune cells, glutamine is a biochemical precursor for glutathione, the body's major intracellular antioxidant. Glutathione plays a key role in detoxification and managing oxidative stress, so supporting its synthesis indirectly via glutamine can be beneficial as part of an overall antioxidant strategy. Athletes and people who train hard often ask, does glutamine speed recovery or build muscle? The evidence is nuanced. For endurance and high-volume athletes, some research shows glutamine can reduce markers of immune suppression and subjective fatigue after prolonged stress, so it can have anti-fatigue and immune support effects in heavy training phases. That said, glutamine is not a magic hypertrophy agent. It doesn't directly trigger the anabolic signaling that drives muscle growth the way resistance training and adequate protein intake do. Many common protein sources, especially whey, already provide significant glutamine, so routine supplementation for muscle size in a well-fed recreational lifter is unlikely to change outcomes dramatically. Where supplementation becomes more useful is in scenarios with elevated demand or inadequate intake. people doing multiple intense sessions per day, those recovering from injury or surgery, individuals with gut damage or malabsorption, or people whose diets are low in complete protein, for example, some strict plant-based eaters. In those contexts, supplemental glutamine can be a targeted tool to support recovery, gut health, and immune resilience. Let's clear up a few persistent myths. First, glutamine is not a guaranteed muscle preserver that will prevent atrophy in every context. Under severe caloric restriction or extreme catabolic states, it may help, but in normal training and nutrition conditions, the effect is small. Second, you likely get some glutamine from dietary protein. If you consume adequate protein, that supplies baseline amounts. Third, more is not always better. High doses aren't proven to be superior for routine use and can cause GI discomfort in some people. So how do you choose and take glutamine if you decide to try it? Start with quality. Look for products that list pure L-glutamine with minimal additives. Fermentation-derived glutamine is a preferred route for vegetarians and vegans because it isn't extracted from animal sources. Third-party testing or certifications, GMP manufacturing, NSF, or USP verification where available, are useful markers of product integrity. Avoid blends that hide dose under generic proprietary blends, or include unnecessary fillers and sweeteners if you're adding the powder to a morning shot. Format matters only insofar as convenience. Powders are common because they're easy to mix into water, juice, or a morning shot, while capsules can be handy for travel. L-glutamine powder dissolves in water reasonably well, and many people take it first thing in the morning on an empty stomach for gut support or after training for recovery. For exercise timing, taking roughly 5 grams before or after a tough session is common in athletic settings. For gut-focused protocols, dosing may be spread through the day. In clinical literature, you'll see a range: low single-digit grams daily for maintenance, and higher divided doses, sometimes 10 to 30 grams per day, in acute clinical trials. Very many dosing plan as ranges used in research rather than prescriptions. Always check with a clinician before using higher doses or combining with other therapies. Safety and who should be cautious. For most healthy adults, short-term glutamine supplementation at moderate doses is well tolerated. Some people report mild gastrointestinal upset, bloating, or nausea at higher doses. If you have severe kidney or liver disease, metabolic disorders, or are taking medications that affect amino acid metabolism, consult your doctor. Very importantly, if you have cancer or are undergoing chemotherapy, speak directly with your oncologist and the treating medical team before taking glutamine. In some cases, they may recommend it. In others, they may advise against it based on the specific tumor type or treatment plan. The same goes for serious autoimmune or inflammatory conditions. Discuss supplementation with the clinicians managing your care. Putting this together, consider glutamine as a targeted, context-dependent tool rather than a daily must-have for everyone. It shines where enterocyte fuel, immune support, or high metabolic demand are present. Think gut recovery after injury or infection, support through intense training blocks, or when dietary glutamine is low. For the average person eating sufficient protein and not under extreme stress, the marginal benefit is smaller. A few practical tips before we close. If you try glutamine, start with a moderate amount. Many people begin with 5 grams once a day to assess tolerance, then adjust based on goals and medical advice. Mix the powder into water or a small juice, or add it to a morning wellness shot if you prefer. Choose a pure L-glutamine product from a reputable company, and if you want a plant-based option, look for fermentation-derived labeling. Track how you feel. Energy, GI symptoms, training recovery, and consult your clinician if you have any new or concerning issues. To recap, glutamine is a conditionally essential amino acid that plays meaningful roles in gut health, immune cell fuel, and as a precursor for glutathione. It can help reduce fatigue and support recovery in high-demand situations, and it may aid mucosal repair in specific clinical contexts. It's not a universal cure for gut diseases or a guaranteed muscle builder. Quality, individualized use, and clinician oversight, especially in oncology and severe disease, are the keys to using it wisely. If you want the exact glutamine I recommend, a pure vegan option included, check the link in the description. And as always, talk with your clinician if you're managing a serious condition before adding new supplements.